Well, thank you, Dr. Johnson, for inviting me to do a guest lecture for your CVPR class. My name is Mjacobmoh609. I'm an Associate Professor of Ethnic Studies at the University of San Diego and also the Founding Director for the Center for Native Health and Culture at Heritage University on the Mjacobmoh Reservation in Washington State. And I think that CVPR is incredibly important for your students to learn about, so I'm excited that they have the opportunity to take the class with you. So as somebody who works in communities of color and marginalized communities, CVPR is a really essential approach to having success in working in those communities. So I'll talk a little bit about why that is, some basic principles of good CVPR work that I've used in my own experience, and then talk a little bit about linking theory with methodology in doing CVPR work within communities. So if you look at the history of health within marginalized communities, and so I do work in Native American communities, so that's what I'll focus on today. We are served by the Indian Health Service, which is a branch of the federal government that's responsible for providing health care for us as part of treaty obligations and in recognition of our sovereign status as members of sovereign nations. And it's kind of tricky because the same government that has really colonized and attempted genocide on our peoples are the same ones who are healthcare providers and healers, if you will. And so there are a lot of contradictions, and for communities of color that continue to suffer with tremendous inequalities, there's always that tension, right? This power dynamic of the healthcare system, serving these folks who historically have not been well served by mainstream American institutions. So that's part of the background and part of the need that scholars and practitioners recognized in developing CVPR, and it has gained a lot of strength and momentum within the healthcare setting. So CVPR is crucial within tribal communities because it brings open the opportunities for tribal peoples to have voice in how our people are served. It gives our people opportunities to have voice in thinking how projects should be constructed and how healthcare systems should indeed serve our people. And it gets away from that model of the non-Indian healthcare practitioner or public health worker coming in, usually non-Native, coming in and telling Native peoples, you should do this to be healthy, or I have all the knowledge about how to be healthy and you need to listen to me. Those power dynamics are inherently problematic. And so CVPR really shifts power so that public health workers and medical practitioners view the community as having assets, so not viewing them strictly in terms of a deficit model, but looking at them, seeing what strengths exist within the community, what is the resilience that's present within the community, and how can we work together to create new ways of serving people, with regard to a public health issue or chronic disease or other health disparities. So that's kind of like the background and the history of the need for it. In my personal examples as a scholar, medical sociologist by training, I've worked on initiatives within my own tribal community, the Mjacobmoh Nation of Washington State, around diabetes. And so how we've been successful in launching health promotion initiatives on our reservation is to early on establish relationships with everybody who's involved in the project. And so this means spending time with tribal elders, with tribal community members, working with key personnel who hold tribal health offices, getting to know them, explaining our ideas of the project, listening to what their ideas of what a good project would be, and then working together step by step throughout the process to really develop what we think collaboratively will be the best approach for serving the community. And it's also important to have community members as leaders within any initiative. If you bring an outsider from a university to be the expert, it's hard for people to trust, because again, it's this person they don't really know, are they telling us what to do? They think they know what's best, but they don't live here. Those sorts of are challenges when you just bring in an expert to impose that power structure on the community. So it's really critical to have those relationships. And within Indigenous studies, a lot has been written about the importance of relationship building to do successful scholarship. So Sean Wilson wrote a book called Research as Ceremony that is really helpful in pointing out relationality is key to any successful research endeavor. So those are some tips that I have about how I've seen work be successful using a CVPR model within tribal communities. Some challenges, of course, are time. Academics, busy professionals, professionals who are also going to school, are very limited on their time. But I think it helps to think of the project in terms of short, medium, and long-term goals. And so when you really enter into relationship with community, you have to see the long term, like, okay, I want to really serve this community over the long haul. One way I can do that is to start with a small project and to learn from that. So that's advice that I have for graduate students and colleagues who are wanting to do CVPR work, is to really think it through, think about what contributions you can make, know what your limits are so that you're not over-promising when you meet and plan stuff with community. So I think other than time, the other challenge can be publishing. Certainly for academics, graduate students who have to finish up a project or a thesis, that can be a challenge. But just to be upfront about it, with your advisors and with key people within the community, and to be willing to be flexible so that maybe you plan to publish on a wide range of issues or a comprehensive project, maybe you're going to be limited, and you'll talk more about the methodology of setting up the project. I've had to do that in some of my own work where when you do tribal health research, there are so many layers of approval that you face that sometimes you have to be flexible about, okay, well, in my dream world I would really write about all of these things, but given the circumstances and everybody who needs to weigh in on the process, I'll only talk about the beginning parts in this paper, for example. So those are some of my my thoughts about CVPR, and I wish you good luck in your projects and have a great class.